So one highlight disease that we're going to talk about in our chapter on the digestive tract is going to be diarrhea. Diarrhea is described as 3 or more loose stool movements within a 24-hour period, and this definition applies towards adults. It definitely does not apply towards newborn infants, who typically average a loose stool once every 60-minute period. Oh, yes, I'm in the throes of that right now. Now, if we look at national averages within the United States, we're going to have about 1 to 2 cases of diarrhea per person per year. So it's a fairly common occurrence. You know, some people refer to it as the big D, so to speak. We typically notice that children experience diarrhea at a much more increased or a much higher rate compared to adults. This particularly can be because children have poor hygiene or oral hygiene or hand hygiene, and because children don't have as highly trained of immune systems. In tropical countries in particular, children can experience up to 10 episodes of diarrhea per year. Within tropical countries, there's actually a lot of cases of diarrhea becoming a cause of death. It's become so severe. We have approximately 3 million children deaths every year from diarrhea. It's one of the big killers in the world. It particularly causes death because of malnutrition and dehydration. Children who are able to survive dozens of bouts of diarrhea are going to typically have permanent physical and cognitive defects associated with having such an impaired nutrient count and fluid count in the body for such an extended period of time. Diarrhea can typically be accompanied by fever, some abdominal pain, cramping, nausea, vomiting, and dehydration. We all know this. We've all experienced that. Within the United States, diarrhea is not as big of a killer, but there still is an issue with diarrhea. Particularly if we look at acute diarrhea, it can be transmitted by contaminated food. Sometimes this is referred to as food poisoning. It's typically not an issue if there's safe food handling practices. So if you purchase some contaminated food and cook it appropriately, you are going to kill off the pathogens or the microbes that cause the diarrhea. It's when individuals don't properly cook or store or prepare the food that, generally speaking, diarrhea becomes much more of an issue. Diarrhea, thankfully, is fairly self-limiting because the microbes that are causing the diarrhea in our digestive tract are flushed out of our digestive tract by the action of diarrhea. In many cases, this diarrhea response is a natural defense mechanism of our body. There are some pathogenic strains of E. coli, such as O157H7. These strains of E. coli have very devastating effects and are very dangerous to contract. In most instances of diarrhea, antimicrobial treatment is contraindicated. It's not a good thing to take antibiotics if you have diarrhea, for most situations. Occasionally, though, it is recommended, particularly if shigellosis is the cause of the diarrhea, but many times antibiotics are going to actually exacerbate the problem by killing off the normal microbiota that we want to retain in our intestinal tract. It's very important to know that which agents are causing diarrhea, but in many situations the specific identification of the agent is not performed. We typically focus on treating the symptoms of diarrhea and letting our body handle the removal of the microorganism. The species of bacteria are going to be divided into serotypes, aka a subtype. These species, different subtypes within a species of bacteria, can have different effects. We have lots of E. coli present in our large intestine, and that's a part of our normal microbiome. Our colon is the namesake for E. coli because they are so common in our colon. However, different subtypes of E. coli, such as that E. coli O157H7, can become pathogenic, whereas other subtypes or serotypes of E. coli are actually very beneficial for us to have. They can produce vitamin K for us. The gram-negative enteric bacteria, enteric is that term referring to intestines, or sometimes referred to as enterobacteria. These bacteria are going to be named according to the antigens they have on their surface. If they have the H antigen, then they probably have flagella present. If they have the K antigen, they probably have capsules. And if they have the O antigen, this O antigen is associated with cell wall formation. So if we look at our gram-negative gut bacteria or gram-negative enteric bacteria, they're going to have a wide variety of subspecies, variants, or serotypes. And these are all going to have slight variations of these H, K, and O antigens on the surface of their cell envelopes. If we look at Salmonella in particular, we found that 1 out of every 3 chickens was contaminated with Salmonella as recently as a decade ago. So as recently as 2004. Remember, the information in this textbook was going to press during the fall of 2014. Now, if we look at the rate of Salmonella within chickens, it's dropped from about 33% down to about 10%. One of the reasons for this is the increased use of antibiotics within chicken farms. Another reason for this is increased hygiene in poultry farms. If we look at other poultry like turkeys and ducks, they also can contract Salmonella. The eggs in particular will be infected with this bacterium because that bacteria can enter the egg before the shell has been formed. And this is one of the big reasons why it's important to fully cook your chickens, your poultry, and cook your eggs. Drinking raw eggs mixed with orange juice may have been popular back in the 1970s as a health beverage, but it's generally frowned upon right now. As recently as 2007, there was also found to be an outbreak of Salmonella within peanut butter. This genus, Salmonella, is a very large genus of bacteria. The particular kind of Salmonella, the particular species of Salmonella that we are interested in is Salmonella entericea, the Salmonella of the intestines. That's the one that causes most of the problems for us. So if we look at the gut bacterium that can cause hospitalizations in the United States, most of our hospitalizations are caused by the Salmonella genus. We can also have some norovirus causes for hospitalization, Campylobacter, Toxoplasmosa gondii, and then finally E. coli, and then there's the big other category, everything else mixed together. So Salmonella causes quite a few hospitalizations within the United States. The Salmonella entera subspecies is going to be further divided into additional serogroups. We can have Salmonella entera cerevisiae. This characteristic of Salmonella, if we look at the genus as a whole for Salmonella, it's very motile. It's going to have the ability to move around rapidly throughout our intestinal tract to help it remain in our intestinal tract, despite the fact that we have that constant flushing motion. Salmonella is able to ferment glucose with acids, and sometimes is going to be able to ferment gases as well. Because of its ability to go through fermentation, it's able to rapidly reproduce and produce energy without access to oxygen. This is good because, for the Salmonella at least, because our intestine is a low oxygen environment. Salmonella is also capable of producing hydrogen sulfide, but not urease. So if we have particularly foul-smelling farts, that can be associated with a Salmonella colonization of our intestinal tract. Salmonella is pretty easy to grow in laboratory media. It's an easy bacterium to work with and is commonly used in undergraduate microbiology labs. Our Salmonella species are capable of surviving outside of the hosts in rather inhospitable environments, so it's a pretty forgiving microorganism when it comes to culturing on laboratory media, and because it's able to grow in our intestinal tract, it's going to be resistant to bile. That's going to be a necessary prerequisite of living in our intestinal tract. So if we're trying to produce a selective medium, some kind of a medium that can select for Salmonella or other bacterium that can grow in our digestive tract, we can add bile to the medium, and that will preferentially select for bacteria that grow in our intestinal tracts. Some of the signs and symptoms that are associated with a Salmonella infection include diarrhea. We can also find that in some cases typhoid fever will manifest itself. Salmonellosis, or also known as gastroenteritis, is the milder form of this infection and has been very common, has been increasing in prevalence since the mid-1990s. If we look at the kind of Salmonella that causes typhoid fever, it's the typhi variant. Gastroenteritis, or inflammation of the gastrointestinal tract, is going to be caused by Typhimurium enteritis, Heidelberg, Newport, and Javanese subtypes. And if we look at the normal biota in cattle, poultry and rodents and reptiles, they are also going to have lots of Salmonella species as well. So Salmonella is a equal opportunity infector of intestinal tracts across a wide variety of species. Particularly if we look here, we have mammals and poultry, or birds and reptiles being represented here. Typhoid fever used to be a common cause of Salmonella infections, but that has been decreasing in prevalence, thankfully. However, increasing in prevalence are other strains of Salmonella that are causing other milder symptoms in our intestinal tracts. It's worth emphasizing that back in 1985 there was an epidemic because of poorly pasteurized milk in the United States that infected quite a few people with Salmonella. Some signs and symptoms of Salmonella poisoning can include elevated body temperatures and septicemia. Those are the extreme situations, though. Much more common are that vomiting and diarrhea or mucosal irritation, so just general irritation of the digestive tract. When most people experience these first three symptoms, they typically chalk it up as food poisoning. If blood begins to appear in the stool, at that point many people will start to go into the hospital. In most healthy adults, these symptoms will subside all by themselves within 2 to 5 days. Death is typically very infrequent when there is a Salmonella infection in the intestinal tract, except unless we're working with a debilitated patient or a patient that is immunocompromised, in which case the severer forms of salmonellosis can manifest themselves. This Salmonella bacterium will have differing abilities to cause infection in our intestinal tract depending on which subtype we're looking at. One of the very important prerequisites for colonizing our intestine is being able to stick or adhere to the mucus that lines our intestinal tract. So whether or not that Salmonella has the correct cellular appendages to anchor itself into the digestive tract and resist being sloughed off and defecated out is going to be quite important for it. Salmonella also can produce endotoxins. These endotoxins can influence the signs and symptoms that manifest with the infection. So these endotoxins are also considered a very important virulence factor for the Salmonella genus. If we look at the ID50, this ID50 tells us the number of microorganisms that need to be ingested in 50% of the test population to cause disease in 50% of the test population. Salmonella has a pretty high ID50. This means that we typically need to ingest a lot of Salmonella microorganisms in order for the disease state to occur. We can still have infection occur, but for that disease state there needs to be a lot of Salmonella consumed. If we look at an animal product, such as meat or milk, this can be contaminated with Salmonella relatively easily during the slaughtering process as the intestinal tract is being opened up, or as Salmonella is working its way through the secretory glands. And if these products are not properly stored or cooled, the Salmonella can rapidly reproduce within the products and lead to food poisoning, or if that product is not pasteurized, the Salmonella can make it into the milk and reproduce within the milk and then make it to us. And most traces of Salmonella that are in common food sources are going to ultimately come from improperly processed eggs or milk. While I'm talking about pasteurization of milk, it's worth emphasizing, though, that just because milk is pasteurized doesn't mean that the milk is free of microorganisms. Generally speaking, fresh milk that's just been excreted by the animal will have fewer microorganisms than the milk that you can buy at the grocery store. The difference is the milk at the grocery store has been pasteurized so that the particularly dangerous strains of microorganisms are not going to be present in the milk at the grocery store. If we look at how to prevent and treat Salmonella infections, the best and only method is to avoid contact with the bacterium. So if you don't get exposed, you aren't going to contract a Salmonella infection. Most cases of salmonellosis or Salmonella infection are fairly uncomplicated. So we're going to treat them with just fluid and electrolyte replacement. Drink some Gatorade and spend a lot of time in the bathroom. If the patient's immunocompromised, though, then that disease can progress to the severe stage, and trimethylprimosulfonmethodiazole is recommended. Whew, that is a mouthful of a medication. It gives anti-disestablishmentarianism a run for its money in terms of being a big word. Another microbe that can cause infection in our intestinal tract is Shigella. Shigella is a gram-negative microbe that forms rods. It's non-motile, non-spore-forming, and does not produce urease or hydrogen sulfide. So if we look at the Shigella infection, unlike Salmonella, which does produce hydrogen sulfide, this microorganism, since it does not, is not going to have the characteristic very stinky flatulence or farts associated with it. Shigella is primarily a human parasite, but it is capable of infecting apes to serve as a natural reservoir. Shigella is capable of producing very similar diseases. However, they all will vary in intensity. So the different subtypes or subspecies of Shigella will all have similar symptoms, but the symptoms just vary in how profound they are. Some Shigella species are going to resemble the symptoms of pathogenic E. coli and can be misdiagnosed as pathogenic E. coli. Shigella infections typically associated with frequent watery stools or diarrhea, fever state, intense abdominal pain, and nausea and vomiting. Dysentery, specifically, is diarrhea that contains blood. Dysentery is a very profound or bad form of diarrhea, so much so that it will contain that bloody stool. For those of you who played Oregon Trail when you were younger, you probably remember that dysentery would kill off quite a few people before there was proper hygiene in place. And a lot of that dysentery was caused by Shigella. But in particular, the stool that has Shigella is going to have the blood, and is typically found to even have occult blood or occulted blood in it as well. The mucus from the GI tract can also be present within the stool itself as it is moving through. So if we find watery stool with blood and with mucus, that's going to be indicative of a Shigella infection within the colon. If we look at how Shigella causes infection, or the pathogenesis or virulence factors in Shigella, we find that Shigella is going to invade the villus cells of the large intestine, those cells that have the villi within our large intestine rather than the villi cells of the small intestine. So if we look at how it gets in, it's going to focus preferentially on infecting the colon, not the small intestine. It will not perforate the intestine or invade the bloodstream, so it's going to remain within our intestinal tract, thankfully. It's capable of entering and infecting our intestinal mucosa by entering through the Pryor's patches. And recall, Pryor's patches are one of our gut-associated lymphatic or lymphoid tissues. It's one of our GALTs. Once this Shigella pathogen gets within our mucosa, it can start to initiate the inflammatory response that causes lots of tissue destruction and the presence of the mucus and blood within our stool. Shigella produces an enterotoxin, a toxin of the intestinal tract. This toxin will damage the mucosa and villi and initiate that fever state within the patients. In particular, we have Shiga-Toxin. Shiga-Toxin is a toxin that's specifically associated with Shigella, and it's going to be responsible for the serious damage that can be caused to the intestine and some of the system-wide effects associated with our Shigella infection. Here we can see an endoscope of a healthy colon. Notice how this colon has been nice and cleaned out. The patient clearly took a lot of laxatives before the endoscope was inserted. And here we can see a colon that is infected with Shigella. So the colon will have lots of blood and mucus lining it. There's going to be lots of inflammation and irritation in that intestinal mucosa. Generally speaking, to contract a Shigella infection, we need to have it enter our body through the oral route, so we need to consume it or ingest it. We typically are going to experience direct person-to-person contact, and Shigella has pretty low LD50, or low infectious dose, so typically 10 to 200 bacteria. We're going to typically find Shigella being associated with low or lax sanitation standards, malnutrition, and crowding of human beings into low or small spaces. Shigella infections can typically be reduced if we have proper hygiene, so hand washing after going to the bathroom, particularly after defecating, and proper sewage handling techniques. Locations that have individuals in close contact with each other are typically going to have Shigella infections spread rather rapidly through them because of that person-to-person contact that's required for a Shigella infection. So if we look at daycare centers, prisons, nursing homes, military camps, all these areas where people come in close contact with each other are going to be prone to spreading the Shigella bacterium. Shigella can be established as a chronic carrier in some patients that will last for several months. This condition will sometimes have some mild symptoms associated with it and sometimes can even be manifested as asymptomatic. To help prevent and treat Shigella infections, clearly we need to focus on good hygiene, washing hands and avoiding contact with infected people. If you come in contact with an infected person, use proper aseptic technique. Wear gloves, wear a gown, and then make sure to wash and disinfect hands afterwards. Depending on who you ask, some individuals say that bloody diarrhea in the United States should actually not be treated with antibiotics, which is the regularly accepted diagnosis for or prescription planned if an E. coli 0157H7 has caused the infection. Many physicians will assume, rightly so, that blood in the stool is due to this particular subtype of E. coli. However, Shigella can also cause blood in the stool. Sometimes the recommended treatment is going to be trimethylsulfomethoxazole, Hoofta. That is a mouthful. As opposed to the typical antibiotic regimen that's going to be used for E. coli. There are also some strains of E. coli that can produce Shiga-Toxin. So we've talked about how E. coli can cause diarrhea, we've talked about how Shigella can cause diarrhea, and now we have E. coli that mimics Shigella by producing the Shiga-Toxin. So we have many different strains of E. coli that exist. Some of them don't cause any disease, some do cause diseases. We spent a lot of time emphasizing E. coli 0157H7 because this particular subtype of E. coli is particularly pathogenic and has been known to cause quite a bit of disease within human beings. Sometimes this E. coli subtype is referred to as the Shiga-Toxin E. coli because Shiga-Toxin rolls off the tongue a little bit better than E. coli 0157H7. If we look at some of the signs and symptoms of infection by Shiga-Toxin E. coli or E. coli 157H7, we're going to typically first see mild gastroenteritis, mild inflammation of the stomach, some fever that will progress to bloody stool, bloody diarrhea, and in approximately 10% of the patients, they'll develop hemolytic uremic syndrome. And this hemolytic uremic syndrome, or HUS, is going to cause the red blood cells to lyse to the point that anemia is induced in the patient. And if we have such massive rupturing of our red blood cells, this can overwhelm the kidney and, I should also mention, the spleen, and cause a lot of damage to these organs. Some neurological symptoms associated with Shiga E. coli infection include blindness, seizure, and or stroke. As recently as 2011, a new strain of HUS causing E. coli was isolated, and this was isolated in Germany. E. coli 0104H4 was identified as the particular strain of E. coli that was causing these symptoms. If we look at how many have been identified so far, we've found 6 additional Shiga-Toxin-Producing E. coli strains that have been identified within the United States. The United States Food and Drug Administration has started testing all ground beef for these strains within 2012 to help eliminate this chances of an outbreak occurring within our country. Shiga-Toxin E. coli has also been associated with high virulence factors. Just like Shigella itself, this particular strain, the kinds of E. coli, produce quite a few Shiga toxins and are very virulent. The Shiga toxin that's produced by these strains of E. coli are identical to the Shiga toxin produced by the Shigella species. The Shiga toxin genes are going to enter the E. coli by being transmitted via a bacterial virus, a prophage. It's also going to be present in the chromosomes of Shigella natively. This suggests that E. coli has acquired the gene through a phage-mediated transfer from Shigella to E. coli itself. This protein is capable of interrupting protein synthesis in our target cells that come in contact with the Shiga toxin. And as protein synthesis is interrupted in the target cells, we have some particularly nasty systemic effects that will manifest themselves as the infected cells, or affected cells I should say, lose the ability to synthesize proteins. We also find that this bacterium can efface enterocytes in large intestine. This is going to result in the bloody diarrhea that's associated with the Shiga-Toxin E. coli strains. If we look at how it's transmitted and the epidemiology of this, the most common mode of transmission for the EHEC is going to be the ingestion of undercooked or contaminated beef products. These products can be eaten raw, but generally speaking need to be cooked. These can include raw lettuce, raw vegetables, apples, and unpasteurized cider. These have been associated with transmitting these diseases, and it's recommended that if you want to minimize your chances, cook them or at least blanch them. It can also be spread through the fecal-oral route, particularly if we look at young children in group situations where they go to the bathroom, don't wash their hands, touch other children, and then those other children touch their mouths. Even touching surfaces that have been contaminated with cattle feces can transmit the disease. If we look at Shiga-Toxin-Producing E. coli, SETC, as few as 10 cells can initiate the disease. Usually, though, we need a few more. To culture and diagnose Shiga-Toxin-Producing E. coli, we typically are going to take a stool culture and then pair it with an ELISA or PCR. The best prevention is to never eat raw or rare hamburger if we want to avoid contracting this pathogen, and to wash all vegetables well. And when I say wash all vegetables well, I do not mean rinse them off with water. I mean use soap while cleaning the vegetables. Shiga toxin is heat labile, and the E. coli can be killed by the heat. So this Shiga toxin is heat labile. It's not going to be destroyed by heating. And our E. coli can be killed by the heat. So we can help to remove or reduce the risk of contracting the disease by cooking our food and killing off our E. coli. The antibiotics are going to be contraindicated for this infection, so they are not recommended for infection because they can potentially increase the pathology of Shiga-Toxin-Producing E. coli by inducing antibiotic resistance. We typically are going to focus on supportive therapy, so we're going to give the patients lots of extra fluids. We'll give them transfusions of blood plasma to dilute the toxin in the blood, as this is the only option available to us at the time. So, wow, that was kind of a mouthful. We talked about a lot of things, a lot of bacteria that can cause acute diarrhea. We have Salmonella, we have Shigella, we have Shiga-Toxin-Producing E. coli, and then we also had some other E. coli as well, such as our EHECs. That's all we have on this section for acute diarrhea from bacterial causes. If you have any questions for me about this material, please feel free to post them on the discussion board or shoot me an email. Happy studies!